Hi again. People often arrive at my office that have been scheduled for surgeries for conditions that can usually be remedied with a non-invasive therapy. There's one factor that they usually have in common. The source of the pain is in the soft tissues, and soft tissues respond readily to the right therapy and seldom require surgery. Carpal tunnel syndrome is a problem of the soft tissues. That is, the muscles, the fascia, and the tendons. To get relief from the pain, the soft tissue should be stretched and released, not cut. The problem is often tight forearm muscles, especially for those that spend a lot of time on a keyboard. But the origin can also be from trigger points in the muscles of the scapula or the neck, and they can cause pain in the wrists and the hands and the fingers. Releasing the muscles and the trigger points and stretching the fascia will almost always get rid of the problem. Unless your knee pain is the result of a direct trauma or accident, you probably don't need knee surgery or replacement. Knee pain is most often generated from the hip and leg muscles rather than the knee itself. Whether it's blamed on the meniscus, arthritis, kneecap tracking problems, or old age, releasing the tension on the surrounding muscles, tendons, and fascia nearly always gives total relief. Hip joints just don't wear out. With the possible exception of someone over 70, any abnormality in the joint or cartilage, though may be present, is rarely the actual cause of the hip pain. Tension in the deep muscles of the hip is almost always the cause of that really debilitating pain. I regularly see people who have been recommended for hip surgery. In almost all cases, their pain was eliminated with MyoLabTherapy. The solution is to work deep enough into the muscle to release that deep tension and therefore the pain. Surgery is not needed for most types of rotator cuff tears. That surgery can be especially difficult for those over 60 because the tissue in that area can be weak at that age and often doesn't heal. And surgery usually needs long post-operative therapy. But that pain most often is a result of tension in the muscles and the tendons involved, plus the wear this tension causes from tendons rubbing against the bone. Releasing that tension can give immediate relief to those painful areas where the muscle attaches to the bone. And then, when that tension is released, the tissue is able to repair itself without the complications and the recovery time that surgery often entails. So, reconsider if you've been sent to surgery. It's quite likely that you don't really need it. And thanks again for your interest.